The Northern Traditional Leaders Committee on Primary Health Care Delivery has played a very important role in the eradication of polio, as polio cases in Nigeria between 1988 to 2021 has been reduced by 99.9%. In a bid to curb the spread of COVID-19 and get Nigeria vaccinated, the Northern Traditional Leaders Committee organized her fourth quarter review meeting at Abuja, where His Eminence Muhammad Sa'ad Abubakar III, the Sultan of Sokoto, assured the Executive Director of the National Primary Health Care Development Agency that they are ready to champion the campaign against COVID-19 and calls on the federal government to fund the agency as they are ready to go out to convince people to take the vaccine and tackle the spread of COVID-19 as that of polio.
Just mere couriers of information to our people. And for us to convince them, the government needs to convince us. Because if we leave such meetings without striking all the issues, we find ourselves not being able to tell our people back home questions they will ask us, because there are so many questions. So many people have so many ways and means of getting information. You've read so many, you have watched so many videos, read so many articles in the papers about COVID-19 vaccine and so on. How do we convince people to take the vaccine if we don't really know how the vaccine works? We've had so many meetings, not of traditional leaders, but even religious leaders, where we discussed some of this. We got experts that explained to our ulama, but still, people were not satisfied. And the way we fought polio is the way we had wanted to go out, but we are limited by lack of resources. For us to convince people, the people must trust us. For people to trust us, we have to tell them the truth. And while we're trying to convince people, those people who are trying to convince must have trust in the government, knowing that government is for them. But like we know what democracy is, it's a government of the people, by the people, and for the people. So we have to convince people, yes, this government is yours. You put it there. How do we convince them to trust the government? Once there is no trust, you cannot have anything positive coming out of your actions.
We use what we have to do the best we can for our people. There is a great engagement between us and the MHD. There is a great synergy in the states. And we're using that to try to reach out to people to educate them on the importance of all the protocols set up by government. I don't think we're doing too badly, but we can improve in that. During the polio campaigns, there was a lot of emphasis on the engagement of traditional rulers from the top to the lowest level. There was a lot of movement into the villages and so on. We had lots of town hall meetings in the villages. This is missing now. And this is what we think is needed. There is need for greater synergy between the committee, the federal committee on COVID, and the traditional leaders of Northern Nigeria. We should also include the lowest level of the institution.
The Executive Director of the National Primary Health Care Development Agency, Dr. Fisher Shuaib, said they are collaborating with traditional rulers in order to increase awareness about the ongoing vaccination, as this similar entity will be replicated in other parts of the country.
The collaboration that we have with the Traditional Leaders Committee is an example of how we're trying to increase awareness about COVID-19 vaccination, but really about primary healthcare as a whole. Our collaboration with this entity, just like we have seen, we have also established a similar entity in the Southwest. We're in the process of also finalizing that of the Southeast and the South-South, so that we have a common platform where we can use our rich traditions, our cultures as embodied within the custody provided by the traditional leaders. People believe in traditional leaders. They are also religious leaders. People believe in what they say, and they provide guidance. We've seen how they've been very, very important in making sure that we eradicated the white polio viruses, and they have been part of the effort against COVID-19, right? We just use platforms such as these quarterly meetings to bring about what are the new conspiracies that people are putting out there, what are the misinformation and disinformation that are out there, and they understand very, very well what the issues are, and they know how to really contextualize these types of information to their people. So they are a very, very strong partner when it comes to our work to increase information and awareness about the need for Nigerians to take COVID-19 vaccines. One thing that we've seen clearly is that, especially in the last couple of weeks, with the rollout of the mass vaccination campaigns to try and get vaccines to every single nook and cranny of Nigeria, that people will have access to more vaccines. The vaccines are now available. It is now a question of people identifying where is the nearest place where they can actually get these vaccines. We believe that we'll be able to meet all of the targets that we've set as long as people also take the opportunity, realizing that we have now vaccinated over 8 million Nigerians. Nobody died from COVID-19 vaccination. 8 million Nigerians cannot be wrong, right? So if you're sitting on the fence, trying to decide whether to take the vaccine or not, just look at the data, look at your neighbors, look at your friends that have taken the vaccines, right? They are fine, right? What we have always said consistently is that after you take the vaccine, there is a likelihood among some individuals that you might have some side effects, minor side effects such as body pain, a little bit of fever. This is something that even children have when they take their routine immunization vaccines. But after 2 days, you are good to go, right? Sometimes you'll have to take maybe an analgesic, a pain reliever to help you get over those 2 days, but they are not so bad.
Dorcas Olariwaju, Voice TV, Nigeria.